Hi, I'm Sarah Matson, a licensed massage therapist at the Anschutz Health and Wellness Center, and I'm going to show you 2 muscles that you can work on your lateral neck. So the first muscle is going to be your platysma, which is the most superficial muscle, and that's this kind of muscle right here. The first thing to do is to work the attachment, and that's going to be up at the mandible, and I like to do just circular little motions coming all the way down to the chin, and I'm waiting for that tissue to warm up. And once that tissue is warmed up, which it might take a little bit of different time depending on the area, I'm going to move on to the next section. So the next area is going to be the clavicle attachment, and I'm just working medially over the clavicle and coming out laterally all the way to that acromion process. And once that's all nice and warmed up, we're going to work the belly of the muscle. And the way that I like to work it is by putting my hand over the clavicle and kind of holding that skin down and creating a ratcheting with my head by stretching kind of that skin and everything fascially and the platysma itself. And I could hold maybe a little bit more medially and come back and get a pull that way as well. Let's move on to the SCM, or the Sternocleidomastoid. That's going to be this muscle right here. That keeps coming up right there. Again, we're going to work on the attachment, and that's going to be on the mastoid process. I'm still doing just those circular motions, warming up that tissue, and then moving down to the other attachment, and that's going to be on the clavicle. And you can do circular motions, you can do side to side kind of scrubbing motions, whatever you feel works best for you and whatever you like. And then going to the top of the sternum, and that's also another attachment for the SCM, and just working that. Okay, so now that they're both warmed up, I'm going to be working the belly, and this one's a little bit different. You're going to do a pincing or pinching kind of technique to grasp it. And so you can go in kind of this way, you can do more of a pinch this way or this way, whichever one feels best and whichever one you can get a better hold on the muscle. So I'm going to hold the muscle, get a good grasp on it, and just initially just take some deep breaths, kind of feel how everything is it moving, is it not? If you want a little bit more motion with it, what you can do is kind of move that muscle back and forth. And you can come up and down with the muscle, whatever feels good, whatever you prefer. You can do circles. And then the next level would be to do rotation. And so I'm just rotating my head back and forth, and that's creating an internal glide because of the activation of the muscle itself. And that's how I'd work the belly of that muscle. I would obviously come over and work the other side as well. And one thing that I would say to be aware of is any sort of veins. If you feel any sort of like pumping or like pulse, you want to come out of that in the neck immediately. But that is how I've worked the lateral side of the neck.